and welcome to another edition of Let's Talk About It, sponsored by the Harford County Health Department. We are so glad to have you here today. My name is Felicia Hopkins, and this is,
Michelle Peterson.
and we are your community health workers out here in Harford County for the minority population. Today, we are talking about another fantastic topic. You're going to see the flyer if you haven't already seen the flyer already. We're going to be talking about the benefits of drinking herbal tea and journaling. Um, I have to admit, that is something that I have not done on a consistent basis, but I love to drink tea and I love herbal teas. So, we're going to give a couple of announcements before we get started because we have a special guest with us today, and I'm really excited to bring him on board. So, the first announcement is this. For those of you that are still having questions about where to be vaccinated or where to get a booster shot, and you're watching this from the Harford County Health Department webpage, you're in the right area. Please go to our website, and they have plenty of information for you to find where to get a booster and if you qualify right now and where to get vaccinated. Another thing, sometimes we don't always know where to go if we need prenatal care. There is a place created by the Harford County Health Department. It is called Megan's Place, and it takes in all clients that have medical assistance. And if you don't have insurance, they take care of all your prenatal needs. There is a dentist office in Edgewood that takes just medical assistant patients, and that is located in Edgewood Plaza. And so we're giving you these announcements. Some people may know, and some of you might not know, but it's out there and it's available to you. And what we're doing today, we have created a series called A Time to Heal, Focus on the Family. And with those series, if you joined Michelle and I, if you've seen us out in parking lots or in neighborhoods, we have been bringing out medical experts like from Healthy Harford, Barry Klein and Robin Stokes. And we have brought out climate action. We have brought people from New York City to talk about the gun violence in our neighborhoods. And we are bringing out experts right now for our winter series talking about, I think, in the month of September. So we're in December now. The month of November, we did dinner and a book, and we had a retired NFL player, Joel Gamble, and he was fantastic along with Mahisa Green, who wrote a beautiful book, Pretty to Be Dark Skin. We still have access to those links and books. So if you're interested in finding out more about how you can get those books, please look at the video that has already been recorded from last month for Let's Talk About It. So, Michelle, please give our audience our disclaimer for today.
Okay, so full disclaimer, this information that you're about to hear is not intended to substitute for medical advice. Any questions about health or diet change, please consult with your healthcare provider.
Thank you so much. That is
You're
so
welcome.
important. So, without further ado, I just want to introduce our special guest for today. His name is Dr. Philip Holstead. And on a personal note, he was my family doctor for about 17 years, I think it was. And I enjoyed his clinic, and his wife was working along with him. And now he has graduated to full time health. And when I bring him on, and I'm going to bring him on right now. Hello, Dr. Holstead.
Hi, Felicia and Michelle. Thank you for having me. Great to be
We're
here.
absolutely excited to have you. Yes, and he's as you explain how you transition from where you are to where you are now for the listening audience. Um, thank you for joining us. Thank you for spending some of your time with us today. We really appreciate you accommodating our schedule and us being able to accommodate yours. So welcome.
Well, thank you. Thank you very much. And just to piggyback on what you said, and just to kind of give everyone an idea of my story, I'm a classically trained internist. Went to regular medical school, and once I graduated and started to practice, I kind of started to realize that the traditional medical system was getting my patients to a certain point in their health, but beyond which they really couldn't get any further in terms of improving their health. So that's when I really started to examine a lot of what's so-called alternative type therapies, um, things like nutrition and supplementation, healthy habits. So that's where I kind of transitioned my practice from a regular internal medicine practice into an integrative medicine practice, where I kind of use the best of both worlds, not giving up on regular medicine, but adding in the natural things that can really help to support a person's function and and how well their health is maintained and established if it needs to be reestablished. So doing that for over 30 years was very rewarding. Um, but I recently transitioned a couple of years ago from regular medical practice to holistic health coaching. And holistic health coaching really kind of has a different bent to it than regular medicine, where regular medicine has, sort of like a hierarchical thing where the doctor is here, the patient's here, and the doctor is constantly kind of dictating to the patient what to do in terms of what medicines to take, what tests to get, and so forth. The difference between that and health coaching is that with health coaching, the patient or client is at the center of everything. And everything that's done with a health coach is done with the permission of the client. Okay. It's not like this dictatorial thing where the doctor's here and the patient's down here. Coaches and clients are at the same level. So basically, what a coach does is the coach establishes what the client wants to do. What do they want? What's their goals? What's important to them? And then everything that is kind of molded into their program is designed to get them what they want. So let's say if I have a client and they want to go to their grandchild's graduation, but their health is faltering. Their diabetes maybe is out of control. Let's say, then my goal as a health coach is to recognize what their goal is in terms of wanting to be functional enough so that they can do things like go to their granddaughter's graduation, but to help them to devise a program which ultimately actually helps with whatever health condition they have, like in this case, maybe diabetes, helping them to make sure that they're eating right, make sure they're exercising, make sure they're staying, taking the medication as they should, and doing anything else that they can to help support them. So what a coach does really is finds out what the client wants to do, and then based on that goal, they work with that client's health in order to get them to that goal. And it just makes it more personal for the client too, because they understand that what they're doing, that client would say, okay, I'm doing these things to help my diabetes, but by helping my diabetes, I'm helping my functionality, I'm helping my health, so I can get to my granddaughter's graduation, without being a burden to my family members because I'm too sick to go. I'll be healthy enough to go. So it's kind of like just trying to relate health goals to the ultimate goal of the client. So that's really what I do now, and it just is a much different sort of approach, but a very rewarding one too, because you're really empowering and equipping the client to really take control of their health rather than feeling like they're just a cog in a wheel or just being dictated to without really having an explanation as far as why they're trying to do what they do.
That's wonderful. I think that everything that you just described is something that a lot of people are looking for. They're looking for that health coach.
Yeah.
And what I also liked about what you do, and to the listeners, Dr. Holstead is a wealth of information. Every time I hear him speak or elaborate on a topic, as far as it's medical or as far as total health, he surprises me. So we're in for a treat. Again, so we're here right now today because um, Michelle and I have been canvassing all summer and the fall. We're talking to residents in our neighborhoods. We're talking to residents in our churches and our family members. The pandemic has done a number on the Black community as a whole. Um, it's done a number on the fact that we've always dealt with job issues. Some of us have always dealt with needing health insurance. We've dealt with the fact that we housing and things of that nature. But the overarching theme that we came up with, people, this one lady asked me, pointed, she said, I really want to know what you can do to help me with what's going on inside my home. They wanted to talk about the loneliness. They wanted to talk about their children. They wanted to talk about the mental health issues that they're dealing with. And so we gave resources, but we're also giving things like de-stressors. And this is one of those things. De-stressors meaning like herbal teas, just something simple as writing our thoughts down on paper. Michelle, you jump in whenever you want to, because we talked about the journaling aspect and writing our thoughts down on a piece of paper. But what we want you to kind of expound upon is the herbal side. I know you know a lot about that.
Yeah, absolutely. I would love to, Felicia. The the whole gist and the importance of this topic really stems from just overall health, but particularly over the last year or two with the pandemic. And the pandemic had as its couple of its main health effects is um, increased stress, but also an increased reminding, I guess, if you will, of the importance of our immune system. You know, with the virus going around, we really had to really try to make sure not only were we protecting ourselves from the virus, wearing masks, social distancing, things like that, but also trying to increase our own inborn ability to fight infections, and that is the immune system. The immune system obviously fights infection, but it's also very prone to the stresses of a pandemic. Just stress itself can really lower the function of the immune system. So that's where, to a large extent, things such as herbal remedies, taking herbs either as a tea or in capsule form, whatever form, such as that, can really come into benefit. So I kind of want to just go through just quickly a list of about 8 or 9 different herbs that are really useful for maintaining immune function and helping people to rest, because stress obviously gets into people's sleep patterns too and causes them to not be able to sleep. And lack of sleep has been known to really increase the risk of many, many diseases and illnesses, just because the body doesn't have a chance to realign itself and to rest. So let me go into this list right quick here. First thing is a couple of herbs that really help with immune support. And again, very, very critical in this day and age. And the first one I want to talk about was echinacea. Echinacea is an herb that is very potent in increasing immune function. It's really used to try to help to shorten the duration of colds and upper respiratory infections. I don't really suggest that people even take echinacea on a daily basis, but I suggest it's taken in spots. At the first sign of a cold, to start taking echinacea either as a capsule or using it as a tea, or tincture form, however form you like to use it, but using it as directed until cold symptoms start to abate. And it has been shown that some people can actually benefit by taking echinacea and shortening the duration of their colds. So echinacea is a big one. Okay. Yeah. And then another herb that's very useful for immune function is elderberry. So I always say the EE connection. The EE connection is good for the immune system. Echinacea and elderberry. Elderberry is an herb that, again, strengthens the immune system and is to be used in spots, whenever a cold starts to come up. And you take it as directed, whatever form you get. I think it comes, I've never seen elderberry in a tea. It may come in a tea, but it definitely comes in a liquid form. And you can just take it, I think, put it in a spoonful in water and drink it down, however the directions say. But elderberry helps also to strengthen the immune system so that colds are shortened as well. So anything that can kind of get immune system boost fairly quickly in spots like that is going to help you in terms of fighting off infections, upper respiratory type infections. So very important, especially for now. Okay. Um, as far as energy goes, remember stress can really rob people of their energy too, because the stress kind of goes and affects you on multiple levels. It affects you mentally, emotionally, physically, spiritually, even, and it just works to sap your energy. So any type of herb that can kind of be energizing is going to be important too. So top on my list with that is ginseng. Okay, ginseng is an herb that comes in, there's actually an American form and an Asian form. The American form of ginseng causes relaxation, whereas the Asian form of ginseng causes energy revitalization. So they kind of have two different kind of effects depending on which one you use. But they're also good. Ginseng is also good for increased immunity, energy, and also brain function too. So remember,
Wow.
under stress, you can get a lot of
So
brain
there's
issues
two
too.
different ones. Let's say that again. There's two different. So
There's
the Asian version is for to give you energy,
correct. And then
and
the
then
American version of ginseng helps to relax you. So
wow, we have to
depending on
really.
what effect you're looking for, that would determine which one you would use.
Yeah, I'm gonna have to look that up. That's the first time I've ever heard that.
Yeah.
Again, another topic from
I've
Dr.
actually heard about these teas, but I never knew the benefit. Well, these ingredients, I just never knew the benefits. So it's good that you mentioned that.
Yeah. 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 There are different types of ginseng out there. So it's important to know about it. Absolutely. Absolutely. Okay. So let's see. Also, things for relaxation and reducing stress and helping with sleep. Another herb that's very useful and comes in a tea form or capsule form is valerian. Valerian is they call it nature's Valium, and actually Valium is made from valerian. The drug companies, as they do for a lot of medications, they take a plant form and then they kind of put it in a lab, alter the structure around a little bit, and then make a medicine out of it so they can patent it. Because you can't patent a natural substance, so the only way they can really do that is to change it around a little bit. But valerian in its natural state, taken in the evening, can help people to relax and help them to ultimately get to sleep. It's not so much that it's a strong, like a knockout thing, but it just kind of helps to slow a person down, mellow them out a little bit so that they can hopefully their own sleep mechanism can take over and they'll be able to get to sleep. So valerian is good for resting, and then also chamomile too. Chamomile tea is very good for relaxing and sleeping. Sometimes a cup of chamomile tea at night can help you to relax. But actually, it's also good for immune function, just like echinacea and elderberry, and also actually helps with GI symptoms too. If people have things like nausea or any kind of stomach upset, abdominal pain, sometimes that can kind of help with chamomile. Chamomile can sometimes help to ease the stress of that. But
I'm,
sometimes those things are related to stress, though.
I have another question.
Sure.
So I was dealing with a client that has several underlying conditions. Are any of these herbs, would they be a hindrance to anyone with uh, with their lungs, or if they have cancer or diabetes or several different diagnoses? Are there any type of herbal teas that they should stay away from?
Yeah, I was going to get to that. After I kind of go through
Okay.
my list of herbs, I'm going to kind of go ahead and talk about some of the contraindications that may occur. Because remember, even though these things are natural substances, natural products, it doesn't mean that they can just be kind of taken willy-nilly with anything. But I'm going to go
Right.
ahead and I'll go ahead and address that in a minute. Okay.
Okay, take your time. Go ahead.
All right. Okay. So another couple of herbs that I think are very useful. Ginkgo biloba. Ginkgo biloba is a very common herb that people use. Um, it works primarily by increasing blood flow in the body. Okay, it has some mild blood thinning ability. It's not like as strong as a anticoagulant medication, but still some. So in that way, it improves circulation. So as it improves circulation, it can improve things like heart conditions, even dementia and memory, because people will get a little bit better blood flow to their brain, so that mental function can improve. So that's one of the things, in particular, memory, that ginkgo has been known to be able to help with. So it can help with people who may be kind of losing some of their mental acuity, as they get older, like dementia and things like that. So ginkgo is a very good one. St. John's wort is another very popular herb that's used primarily for mild to moderate depression. Okay. They found that short-term use of it can be as good sometimes in patients with as antidepressant medication is. The only problem with St. John's is it's not known what the long-term benefit of it is. They have stuff that probably do some more studies to see what long-term use of St. John's does. Does it continue to keep depression at bay, or does it, cause issues? But short-term use, they say for mild depression, it can actually work quite well. And actually, it works by the same mechanism in the body as things like Paxil and Prozac and Lexapro, kind of those antidepressant type medications. It uses the same kind of mechanism for it. Okay, so it can be useful for that. And then finally, the last couple of ones, they're kind of related. They're in the same family as turmeric and ginger. And turmeric is actually in the ginger family. And it's also a very highly popular herb for joint pain. It's an anti-inflammatory, kind of a natural anti-inflammatory. So people have joint pain like their knees hurt or shoulders, elbows, things like that. Turmeric is very good for controlling or at least trying to take away some of the symptoms of stiff joints, just because it takes the inflammation out. And then ginger, its sister, is useful for nausea, immune system function, helping to shorten colds. And actually, ginger actually is helpful for people with high blood pressure sometimes too. So it can kind of help to kind of work with a person's blood pressure. So I think those are kind of like the main basic herbs that people are most commonly going to encounter. So it kind of gives a good kind of like a little overview as far as what those herbs are used for. And always taking them as directed, never mega dosing on anything, because even too much of a good thing is not good for you. So be careful just to make sure that these herbs are taken as directed. The other precautions I wanted to kind of go through is always make sure that you let your physician know what herbs you're taking.
Yes.
Because certain herbs can interact, even though they're natural, and we think, okay, natural means no harm. Taken with certain medications, they can cause issues. Now, I've got a couple of examples here. St. John's wort, the one that's used for mild to moderate depression, is something that you would never take with an antidepressant medication, because the combined effect would be too much. So a mild case of it, maybe if depression was just really super mild, someone could try it under the guidance of their physician. But if their depression got like much worse or started to become more of a problem, then it may be necessary to stop the St. John's wort and maybe go to a prescription antidepressant if needed. But certainly would never use both at the same time, because that would be just contraindicated. Other things like ginger and ginkgo biloba, and they both have mild blood thinning abilities. So in persons who are taking blood thinners, they should best avoid ginkgo and ginger. Even though they don't have strong blood clotting ability, they still could be additive to the effect of the blood thinning of the medication. So that's just kind of another contraindication there. And then finally, things like valerian and chamomile that help with sleep. You really wouldn't want to combine those with a sedative medication, because then that can be too sedating and cause problems for the individual. If they're trying to drive or do something, working around machinery, things like that, then the combined effect of taking the herbs and the medication would be a bit much. So that's why it's important to know, to at least let your physician know what you're taking, because you may not be aware of all these different interactions, whereas the doctor would, if he'd be able to say, okay, you can take this herb or not take this herb based on the medications that you're taking. So very important to let your doctor always know. It's still not clear whether herbs are safe in pregnancy or breastfeeding women. And certainly it's not ethical to do experiments on pregnant women or breastfeeding women to see if herbs help. So I think for the most part, I always suggest people in those states there to go ahead and avoid using herbs until after they deliver the baby or after they finish breastfeeding, just to be on the safe side, because we're just not sure. It may work out that it's okay, but you don't want to take chances like that. So,
Well, that's very important to hear, because I remember I was high risk with all three of my pregnancies. And someone had recommended, and I think it might have been a doctor. It wasn't you. It was, it wasn't you at all. They suggested they suggested chamomile tea because I had a lot of cramping. I was preeclamptic, and so this is way before coming to Harford County. I was preeclamptic, and they suggested chamomile tea, and that's an herb. So I don't know. This information is so vital because we have a high rate of minority women not getting proper prenatal care. So the information that Dr. Holstead is offering, please, as he said, that term, don't do it willy-nilly. We want to offer you some suggestions to help you de-stress. We don't want to offer you anything that's going to harm you or your unborn child. So, Dr. Holt, go ahead,
I
Michelle.
had one. So I know you said that it's not good to take certain medications when you have certain conditions. What do you say for someone who's pretty much healthy and they feel like all these teas, all these herbs can help them? So say if I want to take chamomile at night, ginger in the afternoon, and another two during the evening. Is
Mhm.
that healthy to do that way?
You can do that, yeah, with different herbs that have different functions. And if you're not taking any medications in particular, say you're totally healthy, you're not taking any, a lot of medications, sure, you can take multiple herbs. That they're not gonna taken as directed, as long as you're not mega dosing on anything,
Mhm.
then I think that's perfectly fine. Yeah.
Okay, because I'm here like, oh, I'm ready to go buy all these herbs and get started.
Yeah. This is the other question, and I don't know, we didn't go over this prior to, but as we begin to purchase these herbs, what is the expense of, we know that, just buying our black tea or green tea, we can get that at Wegmans, we can get it at Aldi's, we can get some of those things at Food Lion. What's the expense of some of these herbal teas?
Well, I think that the expense can vary greatly. I think just kind of as a general rule of thumb, generally when it comes to supplements, usually the more expensive it is, usually the better it's made, and the better it is, the higher quality. Because when you get really into kind of like low quality stuff, low end type supplements, those are the things, you go into Walmart and buy a jug this big of 1,000 vitamin C capsules or something for $3.
Yeah.
That's garbage. Okay, it probably doesn't have what's on the label. But one of the things you can really do to protect yourself is to make sure when you buy herbs is to make sure that there's a certification. It should say a certification, should have it on the box or the label that says certified by the USP, which is the United States Pharmacopoeia, or the NSF International. Well, it could be both. If it's both, that's even better. But the USP and the NSF International are the two agencies that really certify the quality of supplements, and in particular herbs also. So that's how you know you're getting a good product. If you see that on the box, then that's something that's worth taking. Other than that, it could be anything. It could be something that's inferiorly made, may not have all the milligram amounts that's stated on the box actually in the product. But when you have something that's USP or NSF International certified, then you know what's on that label is actually in the product. So that's the thing to really look for when you're looking for herbal supplements or even regular vitamins and minerals too. You want to look for those signs.
This is such awesome information. And I want to let our listening audience know again, December 20th at 6:30 p.m., we are going to allow whoever registers to come out and sample some of these teas, along with, you get a nice, cute mug. It might be a Christmas mug or a nice mug that you can take along with you. We'll have some other health benefits inside of our super cute bags. We just got a Time to Heal Focus on the Family series. It's a a gorgeous blue bag to put the information in. And we'll have some other refreshments there. But we want you to pre-register. We want you to pre-register. There's a link that you can go to that is now on the Harford County Health page and website that you can press and find our flyer and bring your family, your entire family, because we're also going to be giving out a journal, and we will have some other authors there that have created different types of journals that you might be able to use to journal your thoughts. Michelle and I had talked about before about the fact that sometimes it's really difficult just to have a journal that you grab every day. I just have paper and a pen.
Mhm.
And those things can relieve stress just to get it off your mind.
Mhm.
Some come as fancy as a to-do list and prompts, but we are very concerned about not just your health, but your family health. And Dr. Holstead is a family doctor. Yes, there are others out there that deal with holistic care, but I highly recommend Dr. Holstead. And we thank you so much for your time today. Um, we usually go for an hour. We're at the 30-minute mark. So we thank you. If there's another question, Michelle, that you might have.
Yeah, I did have a question. So, drinking these most of the teas, naturally doesn't have a great taste. What do you suggest as far as
Yes,
sweetening those teas to make it?
yes, yes. Oh, wow.
I
Michelle,
think
oh, wow.
I think stevia is probably my number one sweetener. You can get it from any health food store or Wegmans in the vitamin section. It usually comes like in a liquid or in a powder. But remember, with stevia is very concentrated. So mainly, if you get the liquid, mainly take like one drop of stevia in a cup of tea would be enough to sweeten it. So you use very small amounts of it, but that way you obviously avoid sugar and avoid any of the other kind of sugar substitutes, which can be very dangerous for you because they kind of get metabolized into other things in the body, like formaldehyde and so forth. So stevia, if you're going to use a natural sweetener, I would suggest using that.
Okay, good.
You don't recommend honey or maple syrup, pure maple syrup?
Those are probably fine too. Honey, I mean, as far as tea goes, yeah, you can use a small amount of honey. There's still some, there's kind of like a mixed bag as far as opinion goes there because people say that the honey gets converted into sugar in the body. It's just as bad as using cane sugar.
Yeah.
So if you want to just go natural, I would go with stevia. But you can go with a little bit of organic honey too. Just don't overdo it.
Hmm. I wonder if there's any other natural fruits that you can put inside of it.
That's a good idea.
That's a good question.
That's a good one.
That might be a question for another time.
That's right. Not sure about that answer there, but yeah.
Well, again, thank you so much. We are so thankful to have you in Harford County. We're going to, for those that are listening, have a link to reach out personally to Dr. Halstead. I'm telling you, don't sleep on it. He's a wealth of information. Um, get in contact with him and also come out and pre-register. Bring out your entire family. We'll have something for everybody there. And that is Mount Zion Baptist Church again, December 20th at 6:30 inside their church building. We're going to be partnering also with The Chosen. And those of you familiar with that, they do food giveaways and a great deal for our community. Dr.
And,
Holstead, thank you so much.
and
Oh,
that,
yes. No. Go ahead, Michelle. Go ahead.
and I was going to say that exact location is 200 Post Road in Aberdeen.
Thank you. Yes, we're out in Aberdeen. For those of you that were wondering when we're coming out to Aberdeen, we'll be in Aberdeen December 20th, 200 Post Road. Thank you, Michelle. And you all have a great evening. Thank you so much for your time. And we look forward to seeing a lot of you December 20th.
Yeah.
Right. Bye-bye.